Hi, everyone. Thank you for joining us today for the IdeaScale webinar, Innovation to Improve Lives, with Bloch Newman from the DC Department of Human Services. I'm Lizzie Fontaine with IdeaScale. We'll get started in just a minute here, but while we're waiting for everyone to join, I would love to hear in the chat where everyone's joining from. I'm currently in Washington, DC. It's bright and sunny out, but I would love to hear where everyone else is joining from. Oh, okay, we have some Canada, Iowa, Phoenix, some Maryland. Oh, there's a lot. I'm trying to keep up here. Kansas City, New Jersey. This is so great to see. A lot in DC. That makes sense. That makes sense. Massachusetts. Okay, I'm from Connecticut, nearby. Virginia, Kansas City, Michigan. Awesome. Okay, yeah. Thank you all so much for joining and for joining from everywhere. We do have this chat functionality on today, but we also have a Q&A. So when it comes time for asking our presenter questions, if you can use that Q&A functionality, and we will have a dedicated time for it at the end. I will share my screen and get started in just a second. All right. Thank you so much for joining today. I'm going to briefly go over who IdeaScale is, introduce our speaker, and then I will pass everything off to Steph. So IdeaScale is a management platform. An idea management platform that empowers governments to harness the power of crowdsourcing to drive innovation. We were established in 2009, actually from a White House initiative, and we've taken off from there. So now we empower 4.5 million users a year to share their ideas. All right, and our speaker today we're so excited to have is Bloch Newman. She's a Deputy Administrator in the Division of Innovation and Change Management from the DC Department of Human Services. All right, and I will pass things off to Steph for her presentation. This webinar will be recorded and sent out afterwards, and at the end we will have a Q&A. All right, thank you, Steph. Take it away.
Thank you. Thanks everyone for coming today. It's humbling to see how many people are excited to hear our story, and I'm grateful for the chance to share it with everybody because it was important to us to set this up. So I just this is the agenda. We're going to talk a little bit about what a human services agency does first, because I know that not everybody is from the same sector. We'll talk a little bit about how we operated before the pandemic, and then that pandemic shaped wrench in operations that changed everything. And how did we find the greatest possible silver lining in what the pandemic did? How did we expand access and we use these emergency provisions to come out with the best possible outcome in terms of technology? How do we continue to improve, and where are we going to go in the future? So that's where I'm going today. So what is DHS? We provide means-tested federal benefits for residents of the District of Columbia. So you might have heard of SNAP before, the Supplemental Nutrition Assistance Program. It used to be called food stamps, but it's called SNAP now. It's the same idea. People apply based on their income and their household size and how much assets they have and other life circumstances. And they put together this application. It is 68 pages in DC, and we're looking to shorten that, but it's quite a bit of information. It might be the same along the lines of maybe one of you applying for a mortgage or a student loan. I saw a whoa pop up there. TANF is the Temporary Assistance for Needy Families program. So that is a cash program. I think a lot of people heard of it as welfare. In the 90s, we changed the name. The federal government changed the name to TANF, but that's along the same lines. They apply with this combined application, and they can get a cash benefit program, cash benefit on a monthly basis to take care of needs like rent or toilet paper and shampoo, because SNAP won't cover things like that. It only covers food. Medicaid or healthcare, I think people have probably heard about this. There are different kinds of different flavors of Medicaid. The big one that everybody's heard about recently definitely is the Obamacare Affordable Care Act that was passed in 2010 or 2011. And that is sometimes we'll refer to it as MAGI. So it's based on your modified adjusted gross income. So you qualify for Medicaid and health insurance based on what your income is. In the past, and we still do have these other flavors of Medicaid, you might qualify based on like a triggering factor about your life. Maybe you are aged, blind, disabled, a child in foster care. So all of these things combine to provide a health insurance program overseen by the federal government. So we take these applications, and in some ways, human services is both a customer-facing operation and social work, but it's also a factory in some sense. And we'll get into that a little bit later too. We take applications and convert them into benefits through a process. So a lot of what we talk about is very process oriented, because people have to come in, do their big application, submit their verification documents. They might need weeks and weeks of pay stubs, and they might need to prove their identity in a couple of different ways. But there's a lot of information that we have to get from them, and we have to follow up with this on an annual basis. We also manage other locally funded means tested programs. So there are other ways to get cash assistance. It's very similar to TANF, but TANF can be restrictive because it's part of the federal government. So we might locally fund more benefits than another state would, because our city council is more focused on social work. And then we also have supplemental benefits that are locally funded as well. All of these things are delivered concurrently. So we talked a little bit about this 68-page application. We have universal caseworkers. So that means you do your one application and any caseworker can pick it up. For the most part, there are some specialized groups, but for the most part, any caseworker can pick up your combined application and see you through to all types of benefits. So I wanted to do a little caveat here, because I know a lot of you guys are going to be tech savvy, and you might say things like, well, if you have so much information from one of these programs, why can't it be easier? And why can't you just connect everybody to any benefit through these programs? But there are different kinds of overlapping federal rules, because SNAP is overseen by USDA, which is the Department of Agriculture. Medicaid is overseen by Health and Human Services, and ACF, the Administration for Children and Families, oversees TANF, and it's a block grant program. So there are overlapping and exclusionary rules sometimes for how we can share information across programs. But I wanted to that's a story for another day, but I just wanted to share that with you guys, because I know you might be thinking like, why can't we get even more innovative? But we have a lot of different restrictions. So before 2020, the services were mostly in person. And I'm saying mostly in person, but they're pretty much all in person. We have 5 service centers around the city, and compared to other states, they might have 1 center per county, but we have 5 centers. Anybody can walk to them, take the bus to them. But we have, because all of our services were in person, we had long wait times and a crowded lobby. And that could mean that we have to call capacity some days. So one of the stories, and I'm not sharing this story to, we all work very hard, and we've gotten more innovative since we've had these in-person days, but I've heard some stories from customers that were waiting in the lobby where they wouldn't send their children to school the day that they knew they were coming to DHS, because they were worried that they would be still waiting in the waiting room when their child got out of school. So it's a huge impact on families who either need to take a day off of work, need to pull their child from school, or just had to wait that long. That takes a mental toll, even if you're not missing work or having your child miss school. But those are some of the real consequences of having a physical lobby where people had to come in and wait for you to be able to accept them and have an in-person, face-to-face interaction, which is limited by the number of seats that you have. So sometimes we would have to call capacity. So calling capacity is we look at our lobby management system, see how many people had signed in for the day, and see how many people were waiting in the lobby, almost like the way you'd manage a restaurant reservation system. And when we got to a certain point in the day, if we knew that it wasn't mathematically possible for everybody in the lobby to see a worker that day, we would say, we've reached capacity, we're going to call limited services. So people could still come in and drop off paperwork or pick up paperwork to fill out at home, but we were letting them know they wouldn't see a worker that day. So we'd also heard stories where someone would have to come back the next day after they had taken a day off of work to try and meet with us. They might need to return. So this is, as you can imagine, resource intensive to have it set up this way. But we didn't have we didn't have a way to accept anything outside of this, because you can't take applications through emails. That's not a secure form of accepting documents. And some of these documents can be HIPAA protected if you have to prove that you have a certain medical condition or disability that might qualify you for one of these programs, especially. So you could you could drop things off and you can pick things up, but you wouldn't always get to sit with the worker. And at this point in time, one of the federal rules for our programs is that you would need to have a face-to-face interview to receive benefits. So even if we could process these documents and accept all these pieces of information coming from different sources, you might still be required to come in and have that interview anyway. So that's why people tried to come in and get everything done at once. So this was our one and done methodology, where we'd have you bring your paperwork in, we'd have you do the interview, and then in real time, if you were missing anything, we could try calling your employer or looking up information online so that you could leave with most of your needs met. So this is how we functioned in the past. We did have a call center, but the call center was only giving basic information. They weren't accepting applications or helping you upload documents, because they were just a basic function of providing information. And the call center wait times were high too. People wouldn't necessarily wait and take their child out of school to wait online for the call center, but sometimes they wouldn't be able to get through if they had to wait more than an hour or so. Just to do a quick, like the life cycle of an application, somebody might apply for these benefits, and then depending on the program, they might need to resubmit a similar amount of information in either 6 months or a year from the time that they applied. So if a person is involved with our programs, they might need to they need to remember to come back on their appointed day in either 6 months to a year from the time when they applied, and supply an extensive amount of information again. So this is another reason that it keeps people engaged with us and visiting the centers. It's not like you just apply for the program and just let it ride. So that was another source of people visiting. And then just to give a sense of scale, we had, before the pandemic, we had about 60,000 families participating in the SNAP program, about 12,000 families participating in the TANF program, and around 250,000 individuals participating in medical assistance programs, so that Medicaid and locally funded versions of healthcare. So after the pandemic, which we'll get to in a second, we are now seeing the increase to about 90,000 SNAP families, 15,000 TANF families, and 305,000 Medicaid families. And another piece of scale is that the city of DC has about 700,000 residents. So if you quick math shows you that probably around half of the residents are receiving some kind of overlapping versions of these benefits. So we did have some modernization that was in progress at the time. We had started on our roadmap for an integrated system when the ACA came out in the Affordable Care Act. When that came out in the 2010, 2013, we used that funding. It was unprecedented funding for our sector that was provided. We were getting about 90% of the funds covered if we could integrate SNAP, TANF, and Medicaid into one eligibility system. So we had started on this roadmap. The 90% match had ended in 2018. So we weren't as aggressive as we had been in the past, but we were still moving towards a full modernization, full integration with at least the back end processing. So the system that we were building, we call it DCAS, for DC Access System. And it was meant to accept the applications for benefits from the residents and then use the information provided to calculate what their eligibility for all of the programs should be. And it sounds simple at first because you think, oh, well, it just has to calculate based on the information that it has, but we have to verify everything. So we have interfaces with multitudes of federal databases. Sometimes we have multiple interfaces with one federal agency, again, because they can't overlap. And we have to double check everything and verify everything. And people have to supply the information multiple times, sometimes 6 months or every year. So we were on track to integrate non-Magi in, and then this is the direction we're moving in. We had prepared to launch, and I'm calling it anonymous uploader. It's not technically anonymous. We know who's uploading it. It's just that you don't have to create an account. You don't have to connect it directly to your case. You just upload your documents, and the workers would have to search through and figure out whose case they went to. So we actually won a grant to build that in 2018. And we had started building it, and it was on its way. We were actually planning to launch it around March of 2020, but we couldn't launch it then because we didn't have enough staff to man it yet. We were we were worried that if we opened a new channel, we would get so much more documentation in, and then spoiler alert, the pandemic happened, so we had to figure out some kind of online methodology. But again, on the other side, some things weren't modernized yet. So we still had a hardline call center. We didn't have any telework policy. We had 500 eligibility workers. They all had desktops, no laptops. And we didn't have a way to do phone interviews that was allowed yet for Snap. So I know that everybody here had some version of this beginning of pandemic switch to pandemic remote operations. So maybe moving a huge call center to a cloud-based system might not be as exciting because you guys have done that. But for us, it just sort of, it just dovetailed with all the other technology that we were trying to build at the time. So this is an artist rendition of a star going supernova. And when I presented my deck initially to my colleagues, they said, you need a really good picture to signify what the pandemic was like. So this is my star going supernova. So the pandemic happened and it shook everything up. So we had to change our operations, our online presence, our programs, our call center. So for our operations, we closed all 5 service centers. We closed the waiting room. So we let people still come in and drop things off and pick things up, and they could fill things out at home and bring it back in. And that was necessary. that was necessary to keep people safe and to keep people from waiting in this crowded waiting room that I just described earlier. So you can even, if you have the picture in your mind, that's what we were trying to avoid at the time. So we couldn't shut down completely though, because people still need benefits. And I don't know if you guys remember the news at the time, but there were a lot of unemployment insurance government agencies that their websites were crashing because so many people were applying for unemployment benefits. I was like praying every night that we wouldn't experience the same wave, because we always have the same pattern as the unemployment agency, but a little bit behind, because once people start with their unemployment benefits, they might have enough unemployment insurance benefits so that they don't need SNAP and TANF, but if it runs out soon, so they'll come and apply with us after that. So we had a same version of that spike, but slightly behind the unemployment insurance agency. So we were able for our operations to move to computer-based call handling. So we had only hard lines before in the past. So we shut down all the hard lines and we moved to computer-based call center. We gave out 500 laptops. We updated the interactive voice response so that it could provide more information. We struck the idea for the anonymous uploader. So it's not just upload any documents you want. We modified it so that we attached it to a web form. So the uploader would now take web forms from people. So it was a true blessing that this was so close to being launched, because it only took about a month to modify it so that we could accept forms and put it into this uploader from people that were web users, not mobile. We created new programs that were coming from federal funding. We launched, there were programs for children who, if you qualify based on income, a school might give you a free lunch every day if you're in public school, well, different kinds of schools. And you might have a free lunch that day. But now that the schools were all closed, those children wouldn't have access to those free meals. So we had to launch another program to cover the cost of those free meals for families that were trying to provide for meals for kids that were now at home all the time. And luckily, the federal government loosened some of the requirements around our programs. So they took away some of the requirements to recertify annually, the way we were saying before, people have to resubmit their documents. They allowed us a waiver, so we didn't have to interview face-to-face anymore. We could call people up and interview them, or we can skip the interview altogether if all the information they provided is clear. So they offered us different ways to check the information so that we wouldn't have to rely on the customer so much to provide it. We also started mailing EBT cards. EBT is electronic benefit transfer. So those cards are, it's like a little debit card, or a debit card, and all of your benefits get loaded to it automatically. And in the past, people used to have to come to the center and pick up their card so that they could activate it and go use it. So that was all of this happened at once. We also switched everything so we could mail EBT cards. And then just as a little consideration too, because I know not everybody's in this industry, that presents its own problems too, because people who are experiencing homelessness are very often served by TANF and SNAP. So now that we're mailing cards, we also had to take consideration for how we could reach people who don't have a fixed address, but still need these benefits. And then we moved more services to the call center. So if you called in, you wouldn't just get basic information about your case. You were able to do more activities at the call center. So we had to shift some of our operations to staff that differently too. And then everybody started working from home. All right. So now I'm going to talk a little bit about the mobile app. I mentioned it in the last slide that's my favorite innovation, my favorite silver lining of the pandemic, at least. So we went from having no online presence and no way to accept forms online at all. And we were very lucky that at the time, it was like a miracle of confluence of all the best situational elements, even through the worst situation in history, where our partner agency, the Department of Healthcare Finance, already had a contract to work on some online materials and put some of these forms online for people to fill out, and put together like a portal for people to access their benefits and see information about their case. So they were able to take this contract and modify it with the new contracting flexibilities that went in place, because everything was in emergency situation. So the federal government let us modify contracts. They let us there were fewer restrictions around the procurement process that we had to do. So everything was still legit in procurement, but the federal government and local governments did give more flexibility, and they let us expedite some of these processes. So and then we also had American Recovery Plan Act, ARPA money come available from the federal government, where they said, make sure human services happens, because this is something we need right now. So with this confluence of, there was a contract in the works, we're allowed to modify it, we have money to change around some of the requirements, and we have speed and buy-in. The question just became, okay, we know that we can put these pieces together and have some kind of online presence. And in this case, it would be a life-saving online presence, because we didn't even know how the virus was spreading at that time. So all we know is we have to keep people out of waiting rooms. We have to keep employees out of the office. We have to make this work. Otherwise, people won't get access to food and to rent money. So the question just became, okay, what do we do first? Do we need a mobile presence, or do we need an online presence? We have all of the parts. What do people need, and how do we reach people? So you can see in my little picture, we tipped towards mobile. We did mobile first. So we were weighing that we knew that, again, customers experiencing homelessness might access the internet more often through a smartphone. We knew that libraries and public access to computers was going to be restricted because libraries were closed, and there people weren't hanging out where there was free Wi-Fi in a Starbucks or neighborhood Wi-Fi areas. Everybody was trying to be quarantined and away from other people. We also called New York City because New York City had the same technology. They had already implemented it in, I think, 2008. And this was the same technology that we were looking at based on the contract that Department of Healthcare Finance, our partners, had procured. So they let us know that from their experience, they found most people were able to get the work done through mobile. Their recommendation was to go with mobile first. And it also helped that if we had launched something online, it would be more difficult for people to scan documents, and it would be more difficult for us to communicate with customers, because now people with no fixed address might also not have a fixed phone number. So we were looking at push notifications and being able to use the camera on your phone as the scanner. So it seemed like, even though there were some detriments, online is seen as traditional. People understand it. There's less apprehension about trying a new technology if it's online rather than on the phone. It feels like it appeals to more different age groups. Our advocacy partners, there are a lot of community advocacy groups that will look out for our customers and make sure that they have an easier time applying, nonprofit groups. And they like being able to use a desktop because they can share the screen and they can handle multiple people if they're coming in for assistance. And then there's also the larger graphics if you get to see it on a computer screen. But we decided that in weighing these costs and benefits, for us, it made sense to go with mobile. So we put all of our efforts and energies into mobile, and we launched in 6 weeks. But which I, at the time, was very intense. I don't know if I recommend any 6-week programs to build a mobile app in the future, but it was so worth it. And then we can go to the next slide, and I'll tell you a little bit about that. So we were able to go. So the tech was done in 4 weeks, but we didn't launch for 6 weeks because the last 2 weeks the attorneys were going back and forth about some kind of licensing agreement. And we said we finished the technology before the attorneys could agree. So why can we go so fast? How did this happen for us? How were we able to look at this, go from this situation of people can't access food and cash to pay for their rent, or to buy toilet paper, or medicines that they need every day? How did we go from this situation to suddenly people have an entire service center in their pocket? Well, we started out behind because the centers were already closed. So on day one, the centers closed, and then we were asked, like, hey, what do we do about this? So that definitely gave us a big push. and I think there was also a lot of emotion around this. Everybody was very bought in to building this with us. And the team became very, very focused on how do we get this done. This was one of even though it was very stressful and nobody was sleeping, and we were getting emails all at 2:00 in the morning every day, it was so, it meant so much that everybody was focused together, because everybody realized the level of importance of getting this done really fast. So someone, even on the team, someone joked, it feels like we were a pickup basketball team that happened to win the world championships. And it really did feel like that, because we had different vendors, different agencies, different teams within the agencies, but everybody knew how important it was, and they knew what their role was in making it happen. And that went such a long way. I think sometimes tech projects can get slowed down because it's hard to explain it to people, and it's hard to make them see what the value is, because they can't picture where you're going necessarily if they haven't seen demos or how that technology might look in the future. It's hard to picture something that you don't understand yet. Especially, and we'll talk about this later too with AI, where there are some things that I don't even understand what it might look like in the future once we can implement AI. And those are the hardest projects to get buy-in for, because you can't even explain it. But this was so clear cut. Everybody was willing to give up their sleep. Even the attorneys, 6 weeks was a record for them. And we also stayed very focused. So we stayed focused. I had never heard the phrase MVP, meaning minimum viable product, before. I had only heard this needs to work for customers. But when we decided that we were going to go with a minimum viable product, and we decided what kind of compromises that meant for us. We decided that the most important thing was timing, because people needed food to live and they couldn't get it by coming in person to apply. So we said the most important thing is having a channel for people to get to food. So we set some ground rules and we said, we're not going to make changes to any of the application questions. We're not going to make changes to any of the back end technology. So if we said, if we ask somebody a question, like, do you pay someone for a room? For a customer, do you pay someone for a room? Yeah, I do. I rent an apartment. Everybody puts yes. But on the worker side, do you pay someone for a room means that you're a boarder, and they have to do a lot of other work if you're a specific kind of boarder. So we couldn't even change that language. It just had to match directly to whatever was on the back end. And that could lead to some kinds of confusion on the customer side and on the worker side. But in the pros and cons, and when we mapped everything out, it was more important for us to get the product out. So we had to train workers on the back end and send out memos and additional job aids for all of the kinds of mismatches like that we knew would exist. We also, because we set ourselves on a minimum viable product at all costs, we also missed some things too, because we didn't get to do any live, like, operational pilot testing. So there were some supplemental forms that, even though we worked with people who were doing these kinds of things every day, we had 2 caseworkers in particular that come to mind, where they were processing cases all day and then still sending me emails at 2 a.m. because they were reading the documents we were putting together. Nobody caught it. But then the first time they had to do a real application with a real customer, they realized that there was a supplemental form that was missing. So the second we knew about that, we had to flip into modification mode and get that new form in there. So it was a really good iterative process once it was on and people were being served and people were receiving food benefits. And I think the other thing that helped us was having that existing contract and the confluence of flexible contract and procurement rules. So I guess, and I think I caught everything about weighing the pros and cons for a minimum viable product. I think at the end of the day, the benefits outweighed it, because we were able to deliver the product and deliver thousands of benefits very quickly. But then we had to stick with the modifications as we continued forward. So we knew that going in that there would be some pros and cons, but having that overarching unifying goal that helped us move this really quickly also helped us launch it. I think when I think of other tech projects that I've done, and I think rightfully so, business users, including myself, are almost never willing to accept something that's not fully baked, and including me, will all vote no to something that we think is not perfect yet, because we think of, like, well, what will a customer think when they see this? Will it actually help them? How will it affect the worker? If it's too detrimental to the worker, then for anything that we've sacrificed to get the customer side easier, now we're going to lose time on the back end, because people have to wait for a customer to process their application, because the worker has to take more steps or learn more things, or the process is more mistake prone. But at the end of the day, we were getting those applications in and people were getting their benefits. So it was worth it to do this minimum viable product. But now let's talk about the improvement. And residents like it. I forgot this one was between the improvement, but everybody does like it. So we have over 230,000 all-time downloads. So that's from since launch till now. And again, our city has 700,000 residents. So I know it's not necessarily 230,000 different individuals, but just to show you that we're not talking about New York City has millions of downloads, but they have millions of people. So for us, this is huge, because our app is relevant to the District of Columbia. So we're only looking at around 700,000 individuals. We've uploaded over 130,000 documents. So that's potentially 130,000 visits to a service center that didn't happen, or calls to the call center because people were able to upload it at home on their own time whenever they wanted. We've seen 30,000 applications come in over just 22 and 23. 30,000 in each year. So this is, so I guess that's over 60,000 in both years, plus the earlier applications too. So there's a lot of residents that we're serving that are applying with us, and we're seeing around 40,000 daily active users, and our robocall percentage is really picking up. So compared to the push notifications. So our robocalls, if we have an activity going on, we'll pull all the phone numbers for a certain population of people to remind them, either don't forget to recertify, or we have an event coming up. We'll probably only hit about 60% of the phone numbers that of the individuals we want, because some of them won't have any phone number, some will have an outdated phone number or a non-working phone number. But we're seeing that if we do a push notification, it will hit about the same level of people, sometimes more. So we know that we're able to communicate better. And the other good thing about the push notification is, since we built a native app, it means it uses the same software that's already in your phone, the software that's native to your phone. The push notifications will show up in the language that your phone is set to. So if you're using your phone in Spanish, the push notification shows up in Spanish. If you're using Amharic on your phone, which is the language we speak in Ethiopia, and it's our top language requirement in DC, the push notification will show up in Amharic. We're still working on other languages, but those are the big two in DC. And our ratings are good. I don't know how many other government agencies have an app that's rated this highly. So now I'll talk about improvements. We're always improving. So since we went live with a minimum viable product, the trade-off is we had to jump really fast into constant improvement and cycling release after release to improve. If we're still doing this, and we're always improving, but right after the first launch was a huge period of intensive improvements to build. And now, of course, we're always improving. So we have an improvement process that's more solidified at this point. So we've had live beta testing in centers where we'll go in with a team of people and pull people out of the line, and we'll say, hey, do you want to try this with us? Come over to this kiosk and give us feedback while you try it. And we'll interview them and see what their feedback is and how we can improve. And then we have individual tickets that come in from people that reported a problem with logging in at the call center, or a caseworker that had a problem with the case. We have our call center and help desk feedback from things that they're seeing anecdotally and ticket analysis that they're doing. And we'll get feedback from customer advocates, so nonprofits that are supporting applicants. We put that through a prioritization process. But at the time, we had a backlog list that we would keep cycling through, and it was going through constant prioritization. And it's tough to get people to agree on this sometimes, because everybody always wants everything all at once. So it's a tough emotional experience to get people to keep prioritizing so strictly time after time this way, until we can keep getting to a final product that we all agree is closer to perfect. But starting with a minimum viable product, it's an emotional experience for everyone to keep bringing everybody back together and having to make those choices over and over. Which one is more important? What do customers need? What do workers need? What do customers need because workers need it? So if something's too hard for workers, we'll slow something down for the customer later. Again, we're kind of like a factory in that way. If the input is applications and the output is benefits, all the things that have to happen in the factory, as all the different handoffs have to go smoothly for the benefits to come out quickly and correctly. I also want to mention that we were selected for a joint program with Code for America. Code for America is a national nonprofit that helps government agencies by supplying coders and intensive expertise for specific projects. So we were lucky to be selected for this project alongside, I think, 4 or 5 other states this year, and they'll look at more states next year or the year after. And they're looking at how to do a customer-centered design program with us and reevaluate how our mobile app is set up, how our website is set up, and bring this intensive expertise. I know I go to a lot of conferences where people talk about user-centered design and how it should be our focus. And of course, we want it to be our focus, but it's hard to find that expertise in a government agency. A lot of our resources are used to provide program expertise or to provide program operations or IT operations expertise. So having specialists that can come in with the expertise to scientifically determine what are the best features and look at the body of research and conduct reviews and conduct actual studies in the centers to make recommendations on maybe how big the radio buttons have to be for them to be usable for people, or maybe if we word the question 3 different ways, which one will actually get us more often to an answer that a caseworker can use to determine eligibility quicker. So then we're looking, so that'll be a 2-year project. We'll prioritize and they'll help us build. This is a very, very lucky thing for us to have. I think it's so hard to find specific user-centered design expertise that can be focused on a project like this. And it's gratifying the amount of dignity that they're going to add to this process so that we can provide quality customer service. And then we're going to look at how to streamline processing as quickly as possible. Okay, the next frontier. I know I'm almost out of time. So these are my hopes, dreams, and wishes. That's this slide. I know everybody's talking about AI, and I know that a lot of this AI has already been around for a long time. When you think about like what year did Watson win Jeopardy? I think it's just that now we're figuring out how we can actually apply AI to our operations. I think people who are marketing AI and looking for uses for AI use cases, they weren't necessarily looking at human services, but there are a lot of uses that we could very well use. For example, I was talking about how we're kind of like a factory. AI can reduce the repetitive role of rote work in our daily lives. So a lot of the work that caseworkers have to do might be data entry over and over for hundreds of thousands of applicants. So we also have to write case narratives for when people come in. We have to write what's going on in their lives and the story about them. So that takes sometimes an hour even after they've done the application. And that's an hour that they could use to process somebody else's eligibility. So how can we leverage the RPA and reducing the repetitive rote work functions by using technology and making human power go even further by giving them better tools, because we need them to think about case processing and not necessarily writing caseworker narratives, which a machine can do for them. We need their human power for other activities that we're really strapped on. We can also look to update the call center. We've seen demos and had discussions with some vendors that can provide their AI can already provide live verbal translations. And we, as a human services agency, we have a lot of people who don't speak English because they might have just gotten to the country. They may, there's overlap for why people might not have a leg up in life if they don't speak English. So we need to give them that leg up in life, and they need to be able to understand how to get benefits for their family. And having live translations for I think they had 70 different language, one vendor. So if they have 70 different languages we can access, where we're not going to have to look for a translator for a very not widely known language, we'll be able to serve people, because we need to serve every resident. And these are tools to increase the human power and increase the human potential, because now with a robot translating, a human has more power to handle that casework. So we can also do sentiment analysis. We've seen, this is on my hopes and dreams list, where it records conversations and it'll mark our workers for how well they handle difficult verbal situations. It can flag a manager in real time when a call is going off the rails, and their manager screen can blink and the manager can jump on the line. It can listen to the call and pull up that person's case, so the call center employee doesn't have to be clicking on different screens and searching. Their information just appears because the AI knows who they're talking to. We've also seen examples of what we're calling co-pilot, where there'll be live assistance and live flagging if a customer has entered conflicting information. So that could save a worker days, because if the customer leaves when they've already submitted the conflicting information, a worker might need to contact them and reach out a couple of times before they can resolve that conflict. But if it's flagged in real time, people can get benefits more quickly. The other things in Copilot are similar along those lines: checking documents, making sure that the verifications are happening, things that multiply human power across more people. And the digital mailroom, we just got a grant from Food Nutrition Services, branch of USDA, oversees SNAP, and we're going to try to start building our digital mailroom, where we're going to use OCR, optical character recognition, and robotic process automation, so that it can read the forms that are being submitted to us, because we've seen demos, and some of the optical character recognition software can read human handwriting in multiple languages with more accuracy than a human can, because it can train on different kinds of handwriting, and a human only has their own experience, but the robot can have experience of thousands of people's worth, because it can read many documents very quickly. So we're looking at how to that'll speed up like the input end of the process. And we're also looking at some business process mining software that can help us map our entire business process by dumping all of the timestamp data in, and it can map, I'm so excited for this one. It maps our whole process flow, and it tells us where the bottlenecks are and where things go awry, so that we can target and make, we can use our resources in the most wise way possible, because we'll have true information about what's actually happening. So I'm really excited about the potential for AI in human services. And now that I've seen all these demos, I'm just like very excited that we're trying to pull this all together. So I guess I didn't say this in the beginning, but this is my team, the Division of Innovation and Change Management. We take this kind of work to see how we can slot things in around the agency, and the agency comes to us with their problems, and how do we look at procedures and processes to keep improving them. So that's why AI is our next frontier for me. I think that is it for me. Does anybody have questions?
Thank you for your presentation, Steph. That was awesome. I'm looking at the Q&A now. Let's see. And if anyone has questions, feel free to click the Q&A on the bottom and send them in there. Let's see. All right. One user would like to know, what is the impact of the use of AI on the ability for humans to keep jobs and not become obsolete, thereby creating more people who need the assistance of the software designed to facilitate?
Yeah, so I feel like I have a cheat answer for this question almost. The federal government does not allow benefits to be given out, well, at least for SNAP, without a human pressing the approve button. So the answer is we are not legally allowed to eliminate humans, but our caseload is so high right now. So I draw a line between 2 points that I presented. At the beginning, I talked about how we called capacity if there were no humans around to sit with somebody. And then later we talked about how we just opened the door to apply online anytime, anywhere. So and then I showed you about how our caseload is much higher now. I think it's 40% increase. So right now we are so underwater that any sort of boost from AI will at least get us up to being able to handle the work that we have to do. So there's the cheat answer, and then the real answer is that we need to keep providing tools to the people that we have, so that we can keep striving towards getting out from being underwater. And I'm going to copy someone else's line too, that their friend asked their doctor, is AI going to replace doctors? And the doctor said, no, but doctors who use AI will replace doctors who don't. And I think that's how I'm thinking about AI, is that we have so much human potential, but the job that we need each human to do is too hard for one person. So we need to give them better tools so that each person can do their job better. I don't think we'll ever be able to get rid of humans in this sector. It's human services.
Fair, very fair. I have another one for you here. Do you have any positive outcomes, any stories of positive outcomes that have come about because of the app?
Um, any one story, or I feel like the story is that thousands of people have benefits now and they didn't have to go to a service center. I feel like when I think about the app, I think that the app saved lives, because if we hadn't had the app go when it did, the only other choice was to send people back to the office to take applications. So we would have had sick employees, we would have had sick customers, we wouldn't be quarantining people. This is when we first launched, we didn't even know that masks were the thing that helped us out. So I see this app as that's the baseline benefit is people got benefits and didn't have to go to the center at the time.
True. Yeah, that's very widespread. All right, let's see. How do you facilitate and enable people with niche ideas to validate, implement, and scale the solutions sustainably?
Ooh, okay. So we, on my team, we do have a lot of good ideas, and it's very exciting. We almost have too many ideas because we have all our regular work to get done too. But we'll test it out. So like an example that we did with the beta testing was the tech team was saying that they thought they could help us out by automating some of the connections between what a customer was going to submit and how it would populate directly to their case. So so we didn't know if that was actually going to work, if it was actually going to help people, or if it would be more confusing. So we went out to the service center and we've changed the settings on the accounts of people that were willing to participate, and we tested it out as if this had already been launched, and we got their feedback. We had workers set aside to process the applications that came through just from these people, and we got their feedback, and we were able to put together a proposal based on customer and worker feedback for how that idea could be implemented. And today that the idea has been implemented.
Awesome. Have you thought about, and I think this is a widespread issue in all of government using AI, and or not even an issue, but like a topic. But one of the questions is, how will you protect data privacy using AI?
I will count on our CIO to do it.
Yeah, fair. That is fair.
Our child and family services, they are testing out some AI case narrative stuff. So that's highly protected information, because it's kids that are coming and going from different care and different families, and they might have very complicated histories. So I know that their tests are being done in a SCIF. What does it stand for? It's like a sequestered, secure, contained information facility. So they set up it's like a SCIF outside of what our even government network, and that's how they're testing it. So I know they're working with our statewide IT office, and we'll probably benefit from the results of their testing. So that's my answer.
Awesome.
CFSA will figure it out.
Thank you. That's great. All right. This is Tanya wants to thank you for your presentation. It was really insightful.
Thank you.
There's a couple parts to this question, but I think the main takeaway is that your experience trying to incorporate or beginning to discover and incorporate AI could be beneficial for other agencies struggling to figure out how to incorporate it. They would like to know, how did you realize that AI could be part of the solution? And they're interested in understanding how the AI culture formed on your team. Was there one person that brought about it, or like how did that process go?
Yeah, you know what? I don't even remember how we got connected, but I know the day that it started. We had a call with New Mexico. I make a point to really connect with other states, especially people in my same role, because all 51 of us are trying to solve the same problem at the same time. So and we're all trying different ways, and each state has different restrictions too, because their state legislatures might lean one way or the other. So they have a different like petri dish. They have different ingredients in their petri dish that's giving them their ideas. So it's really helpful to stay in contact with other states. So we had this phone call with New Mexico, and New Mexico had just launched a digital mailroom where they had processed 40,000 pieces of return mail in like 2 weeks. And they were telling us about an RPA that they were using, so that if someone had a new baby, it took them 10% of the time to add the baby to the existing benefits case, that's huge, because it could be days. and they're shaving off all this time. They're making it less work for these families having babies. The babies get benefits faster, and the workers can go on to more complicated cases and more complicated family scenarios other than just adding a person. And we recorded the call with New Mexico because we were like, oh, this is cool, let's record it. And that call was like mind blowing because they were telling us about all these use cases that we hadn't even dreamed of. So, and then what we did was we had a watch party for the recorded call. And we ended up having another watch party after that. And people were so excited about it that after that we started calling all of New Mexico's vendors and asking for demos. So once we had like an offsite demo for a whole day and we got to build our own bots, we got to work with some of the business process mining software and build our own timeline analysis. And we were just bringing in people from all ends of the business side. We brought in people from the CIO's office to come to that demo with us, the offsite demo. They built their own bots. We brought in people that are processing cases and they built their own bots. So it was, I think it was like a moment of excitement when we realized how these use cases could apply to us. And then the buy-in came by bringing everybody to these demos and events and having them say, oh my God, I can't, this is real. It's when it's so new like this and people can't envision what it's going to be like, that hands-on relationship really matters.
I love that. I love that you had watch parties. That's so fun.
Well, because I think sometimes when you record something, you think you're going to make time for it, and then you don't because nobody else is watching it. So if you all do it together, then we were chatting on Teams. Can you believe they said this? Can you believe they said that? How do we get this?
That's awesome. All right, we have time for one more question. All right, this one's from Nora. She said, jumping off of your discussion of getting to a MVP, does your agency now do UX testing of sites and applications?
Oh, well, so yes. I'll say yes when we can. Sometimes we don't always have the time and resources to, but one of the projects that my team is working on, I'm so proud of. They found this experienced graphic designer who redid Michigan's combined application, and she helped. She was on the project that took it from 42 pages to like 15 pages. So the team is working with her, and she's teaching us also. And there's a nonprofit that's also teaching us, and they put out materials for how to do this testing. So we've been doing a lot of our own research about how to set up the tests, and we're doing an iterative process. So we're just starting in the last few weeks a project to take the application from 68 pages down to I won't say I have a goal in my head, but just something more manageable than 68 pages, because that's really intimidating, and it's difficult for customers that when they come in and they need our help, they're at a very stressful point in their lives. Handing them a 68-page booklet and saying fill this out to eat is difficult. So we're working on that. We're learning about design principles, and she's showing us how just if you Google search Michigan's combined benefit application and look at it compared to ours, that's where we're headed.
That's so exciting. Congrats.
Thanks.
All right. Thank you so much, everyone, for joining today. Thank you, Steph, for being our speaker. That was a really great presentation. And I will be sending out the recording to everyone afterwards, so everyone can rewatch and have their own little watch party.
Everyone should have a watch party.
Yeah, twice. All right. Thank you so much. Goodbye, everyone.
Thank you.